Welcome, folks, to the Regina District Industry Education Council Career Spotlight featuring the one and only Kristen Bellows. She is a registered psychologist and she is working with Prairie South. So she will share her journey with us today. Also, if you're a student listening or watching this presentation, please fill in the survey from the RDIC IEC website for a chance to win a $50 gift certificate and give us some feedback on how we can improve these sessions.
Thanks, Troy. Well, I appreciate you having me here today. I hope that I'll provide some information that might be helpful. And obviously I can be reached after the fact if there's other questions that come up. I, as Troy mentioned, work as a psychologist. I'm a registered psychologist in Moose Jaw. I work most of the time as a school psychologist for Prairie South. And so that's serving K-12 students. I also work in private practice on evenings and weekends for a company that I have with a colleague called Insight Assessment, where we provide primarily learning assessments, but also some behavior assessments for those that are seeking those services privately. Before I did this job, I worked as a school counselor in an interagency program for quite a while. And I also worked in a domestic violence shelter and an addictions facility. So I had a little different perspective, I guess, coming into this role, but always in some kind of helping profession. And I've been doing this particular role now for about 15 years. So as I mentioned, I work primarily as a school psychologist. The number one thing that people seem to think of when they think of school psychology is testing, and that's not wrong. There's a lot of testing that is a part of the work that we do. And so when I say testing, I'm talking about intelligence tests, IQ tests, as well as academic tests. And that's the bulk of the work. We assess students to figure out where they're strong, where they struggle, and what they need to have more success at school. We do a lot of collaborative work with other team members. So that might be speech pathologists, or we have social workers in our school division who do a little more direct behavior support. There are a lot of consultants and teachers, administrators. It sort of runs a gamut. We debrief our findings with families and with, again, school staff. And we do a lot of different kinds of assessment. There's a lot of in-person direct testing, but we also do behavior ratings, observations, interviews, all kinds of things. Probably the most, let's say, tedious part of the job has to do with writing psychological reports. I spend a lot of time writing, a lot. And it gets easier, honestly, as the years go on and you start to come up with a system for communicating what you're trying to communicate. But it's definitely one of the more tiresome parts of the job is the report writing. You want to get out and you want to be working directly with kids and with families and with teachers. And if you're stuck in an office writing reports, that can get a little old at times. We do some training for things, topics as they come up, self-regulation, self-care, coping. I have a request right now actually to do something on executive functioning, which has a lot to do with planning and staying organized and working through tasks. We do support and advocacy for students who have a whole host of challenges. And it's really our job to make sure that we are working for kids to make sure they get what they need. And if kids are understood, then we're better equipped to get them what they need. And we also support classroom teachers when they're asking, how do I do things differently so that this student will get what he or she needs? I laughed when I was trying to think of how to describe where we work. Some spaces are better than others. We are itinerants. School psychologists are itinerants working with an office in one space, and we sort of shuttle out to all different places. I myself have 5 different schools. So some of those are in the city of Moose Jaw, and some are rural schools. So there's a little travel required for my particular job. In each of those schools, it is an ongoing struggle often to find space to work in, because there just doesn't ever seem to be enough. But most of the time, we're provided with some office space, or we borrow an office or a classroom where we can work directly with students. We're forever asking for private, quiet spaces, because that's sort of optimal for assessment purposes. Those can be hard to come by at times. I have a little picture of some of the equipment that we use, mostly because that's something that's, oh, moving ahead on me. The test kit that's listed there, that's one of the most administered tests that we use all the time. Our WISC kits, they're called. So that's the Wechsler Intelligence Scale for children. So I used to shuttle from school to school carrying luggage like I was running through the airport. But that's changed a fair bit recently, because in the last 10 years or so, there's been a move to more digital systems. And so right now I can do most of my testing using iPads, one for me and one for my client or student. And it's pretty remarkable how much lighter my bags are with that in mind. But we're definitely on the go. So we travel and find spaces wherever we can to do our job. Unknown duties, there's quite a bit of research that is also required. Things change fast, and the more we learn, the better equipped we are to serve our populations. And so I think that maybe that's underestimated, how much time we spend in research and should spend in research. Another thing that might not be realized for people looking at maybe a career in this field, for school psychologists in particular, there isn't a tremendous amount of direct counseling that we're doing. So we don't get to do an awful lot of therapy work unless you happen to be in a location that supports that. But by and large, at least in this province, psychologists primarily do assessment and diagnostics and in consultation. But there's a much smaller counseling component to our work. Often there are social workers or school counselors that are hired to do direct counseling with students, often based on the recommendations that come out of our reports or our assessments. Another thing to note is there's often a lot of participation on committees that oversee how psychology works in the province. It's some of the best professional development I do, honestly, is to participate in those committees. But I think it's not something that people often think of. And I'll maybe touch more on that a little further in the presentation. Rewarding parts of my job, definitely getting to work with kids. You learn so much about so many different people, and feeling like you're helping it's a pretty powerful thing. I love my job. I really, really, truly love my job, even though I don't always love writing reports, and it can be a little tiring sometimes. But I love solving puzzles. Is sort of the best way I've been able to describe it. Is when you have a child in front of you, or a teenager in some instances, and they're struggling, and it's your job to help figure out what's going on. And you gather all of this information and put these pieces together to find out hopefully a pretty comprehensive picture of this kid, and you are the one who gets to help move things forward for that kid and helping them get what they need. And I really like rooting for the underdog and working to make school positive for every kid, not just those A+ learner kids who everything came easily for. I really enjoyed the kids that sometimes other teachers maybe struggle to like, or that can be more challenging. Those are often my favorite kids. So that's quite rewarding in this work, at least for me. Challenges and stressors. I said that demand exceeds capacity, so there's just not enough time. I marvel sometimes at how much there is to do out there, and I don't often complain about it. I will always have work. There's no shortage. But it can be a little overwhelming when you feel like you're not able to do everything that needs to be done. I mentioned report writing. I think that's probably the #1 beef that people in a school psychology role would have, because it is such a big part of the job. Another thing that maybe less thought of would be when you put all the work into an assessment and writing a report and making recommendations that you've poured your heart and soul into, and you don't really have a role in implementing those things. It's really your job just to make the recommendations, and then it's up to teachers and families and students to bring those to life. And it can be a little frustrating when you know what needs to happen for a student to have more success, and the people that are on the other side of that knowledge, or at least what you think was good knowledge, aren't able to make it come to life. It's also really frustrating when they're trying and they don't have the resources to make recommendations come to life. I might be recommending what I think is the very best thing for a student, and there's just, there isn't enough money or resources to make it happen the way that we want it to happen. So that's frustrating for sure. I have a little screenshot here of the, I guess, the salary grid for teachers in Saskatchewan. So at my particular school division, our salary is based on teacher salary, and then we have a consultant allowance on top of that. In private practice, the current rate is $180 an hour, though you can declare your own rate. I mean, your private practice is up to you to determine what you charge, but that seems to be the suggested rate from the professional associations. That's actually under review right now. They're talking about increasing that. In some other provinces, it's upwards of 220, that kind of thing. But some will charge more or less depending on their own skills, expertise, or expenses. Pretty lovely benefits package working in a school division, but again, that will vary depending on your employer. In a school psychology role, we work the school calendar. So I work when teachers work. My hours are a little more flexible. Obviously, I'm not ruled by bells, kind of the same way that classroom teachers are. But we need to be flexible in terms of our availability. So sometimes I have to be on the highway, at 7 to get where I'm going. And sometimes, meetings go late, or we'll have evening meetings to accommodate parents who have work schedules that they can't come during a school day. So it is a little bit variable, but for the most part, it's a Monday to Friday gig and standard business hours. Training and support. So again, province to province, what is required in order to license as a psychologist is a little bit different. But in Saskatchewan, you can either be trained at the master level or the doctoral level. You must license. You cannot practice as a psychologist without being licensed with the Saskatchewan College of Psychologists. So that's our regulatory body, and it's their job to protect the public. So they oversee what psychologists in this province are doing, and they make sure that we're practicing ethically. And if someone is not practicing ethically, they can be under investigation and up for discipline. They can be fined, they can have their license taken away, all kinds of things. So in order to license as a psychologist, there's a provisional period where, and it usually is about a year. It can't be any longer than 3 years, I believe, is the requirement. So after you finish your master's degree or your doctoral, your PhD, you need to be supervised for at least a year, where there's another psychologist signing off on the work that you're doing. You need to complete an exam called the EPPP, which is the examination for the professional practice of psychology. It's about 4 hours, and it's hard. It's really hard, but it's passable. It just requires a lot of studying. It's one of those tests that you practice again and again and again, all these practice tests, and you just get better at understanding the format of the test, and you improve. And so it requires a lot of prep, but it's passable. And then there's an oral exam at the end of that 3 years, which I participate on the oral exam committee for the college right now, where I chair panels. So myself and two colleagues will do an oral interview of provisional psychologists who want what's called a full practice license, which means they can practice independently in our province. So they will submit their work samples. So we get 2 work samples, and we as examiners review their work and ask questions about, why they drew the conclusions they did, why they chose the instruments or tests that they chose, how did they come up with those recommendations, what research they relied on to determine that it was the best course of action, that kind of thing. And at the end of that, if you pass, then you get a full practice license, which allows you to work independently in the province, again, under the supervision of the College of Psychologists. So they oversee everything we do. Opportunities in the field, there's about 500 sites in Saskatchewan right now in different kinds of practice. So you are licensed with a general license. So we all are considered registered psychologists, but we all specialize a little bit differently. So I personally specialize in learning and behavior. So I'm practicing school psychology or educational psychology, but there's forensic psychology, which is anything that has to do with the legal system. Geropsychology, which is working with seniors populations, and that is a growing field. There's a tremendous amount of interest there. Counseling psychology, where you may do less assessments and diagnostic work. Clinical, sort of working in health settings and dealing with clinical kinds of disorders. Rehab psychology, neuropsychology. There's a much longer list than this, but those are the ones that certainly come to mind. In this province, the majority of the psychologists that are employed are actually working in school psychology. That's the field that most of us are in. In terms of work-life balance, as I mentioned, there's a lot of different fields there, and the ways that people operate in their career could vary a lot depending on which specialty they choose. I mean, for me, working in a school setting, I think it's a lovely sort of opportunity for a work-life balance. You do have to set good boundaries for yourself. And I think that that's the case for any helping profession, where often the people who get into those professions are the ones who they just care so much and they really want to do right. And sometimes will go above and beyond. And that's wonderful, except for when it's to your detriment. So it's always important in a helping profession to make sure that you're practicing lots of self-care and taking the needs of your family and your own self as just as important as the people that you're helping. I don't have anything else to talk about off the top of my head, but I'm happy to entertain any questions if there are any.
Great. Any questions? There's a couple of students here, I think.
I have a question. I'll start the conversation. Thanks so much, Kristen. That was awesome. You talked a little bit about the education of having a master's, but where would you recommend students get that psychology, maybe that initial undergraduate degree? Is it the U of R, U of S? Is that basically the psychology that you're talking about?
I guess depending on sort of which part of the field you're hoping to go into. So if you want to be like the path that I took, I did my bachelor's degree, so it was a Bachelor of Arts in Psychology at the University of Regina. There is a psychology program at U of S as well. And of course, outside the province, there's loads of other programs. I can't speak to the quality of any of those programs because I have my own limited experience to draw from. But the U of R had a perfectly adequate psych program for my bachelor's degree. I also did my master's there as well in the Master of Education program, which is a specialty in educational psychology. So you don't have to go that way. You can also apply to a master's program in an arts or science, depending on which university. Sometimes they have psychology sort of a pseudoscience. So some will class it as a science program and some will class it as an arts program. But you can just pursue psychology directly without an educational component, but that does vary school to school. Does that answer your question?
Yeah, that does. And I do agree with you that the University of Regina does have a very awesome, very reputable psych department. And I think any student choosing to stay within the province is guaranteed a very good education.
Certainly.
Just a comment, Kristen, I guess myself being a teacher, I didn't realize that the psychologists were in the teacher salary grid. That's
Yeah. Well, we are. That doesn't necessarily mean that you know, that's everywhere, but that's certainly the case.
That's not a standard thing. Okay, I just didn't realize that. Okay, sorry, I didn't catch that. Yeah, so yeah, that's very good to have the same benefit package.
I think depending, because you can license as a psychologist with slightly different paths, right? Once you get licensed, but if you weren't a teacher to begin with, or if you didn't have a master's of education, then you wouldn't be in the STF. So I'm an STF member. So they class me on a STF salary grid with a consultant allowance. But if I wasn't an STF member, the pay scale would still be the same. I just wouldn't be technically on the teacher salary grid. Does that make sense? I think they just have a parallel grid for people who are out of scope.
Grid, that's, yeah.
Look, there's a question on the chat here. Are you allowed to give medication to patients, or do you just recommend somebody else for that?
Right. So there's a difference between psychologists and psychiatrists. So psychiatrists are medical doctors and they prescribe medications. Well, all doctors can prescribe medications, but psychologists cannot prescribe medications. We would convey diagnoses. So for instance, if I diagnose ADHD, I would recommend that they have, the student that has a diagnosis and their family, that they take the report to medical doctor and do any rule outs, and then they can pursue some treatment options that way. Medication may be one of those options. So we have diagnostic privilege, but we don't have prescription privilege. Like we don't prescribe medication, but we do convey diagnoses.
You talked about the amount of writing that has to happen in your career. Who sees, I guess for the students that are listening to this, and who sees those reports? Are they written specifically for the schools? Are they, is what gets sent on to doctors? Is that what gets presented to parents? Like who's your main audience, and the detail of writing those reports?
All of the above, actually. The reports that we write, so it depends, it's probably the truest answer, but in my school psychology practice, the report that I write is debriefed or shared with the classroom teacher and student support teacher. And depending on the age of the student, so if it's a much younger student, they're not typically a part of the conversation, but high school students often are there to get the results of their assessment. So the teachers, the client or student themselves, their parents, and then depending on the findings of the assessment, that may be forwarded on to physicians or psychiatrists or other professionals. So maybe a speech pathologist I want to refer to because there's some language dysfunction that I'm seeing in my assessment, or an occupational therapist or other professionals that have sort of parallel roles. So any member of that team may be the audience that report's written for. So it's tricky sometimes to make sure that you have to strike a balance between readability, something that's understandable to everyone who may be the audience, and also professionalism, right? Like there has to be a very professionally written report for to live in a file indefinitely.
Thank you for sharing that with our students. That's good information for them to have.
Thank you.
Any other questions? What are the methods for diagnosing?
Well, we use what's called a differential diagnostic process, which is a sort of a fancy term. Actually, this a lot. Oh, it says DSM. Easier. There is in that book a commonly understood sort of set of criteria for a whole host of different conditions that people may experience, and that's the common understanding. And so we rely on a DSM, so that book, to have a common understanding of what it means to have a learning disability, or what it means to have ADHD, or what it means to have an anxiety disorder, or what have you. So when I see a student or a client, I gather information from directly testing them. So I will look at their performance on different measures compared to other kids the same age or other adults the same age, to see if anything is obviously an area of strength or an area of struggle. So if there's areas of struggle that are starting to emerge that I see, I make note of those. I observe how they're functioning in day-to-day life. I do interviews. So I'm just gathering a whole bunch of information through these different sort of systems. Once I get all of that information, I have to then come up with a hypothesis or my best theory of what's going on. And then I can start to work through a process and use that manual to make sense of, okay, what do we call this? Is there a diagnosis that explains this particular pattern? And if there is a diagnosis, and that will lead us to services or supports that will help improve the situation of this student, then great, right? Then we know what to do next. Diagnosis is sort of a double-edged sword. On the one hand, it's frustrating to me because I don't like the idea that my job is to rubber stamp kids with a bunch of labels that now become their identity. However, diagnosis is quite important if it puts us on a path towards treatment and access to services that we wouldn't be able to get otherwise. For instance, an autism diagnosis often opens the doors to services that there's no other way to access. So as much as diagnosis can be a little bit, it's a double-edged sword, right? Like you don't want that to become someone's identity, but you want to make sure we're opening doors for service. So the process is information gathering, checking that information against the research that we have that helps us make sense of that information, and then writing that up in a comprehensible way in a report to convey a diagnosis. I hope that answered the question. I get a little rambly.
She said thank you.
Oh, okay, great.
So it must have hit the target. Well, I'm not seeing any other questions. So thank you very much, Kristen, for your thorough and professional presentation. It was awesome. I'm sure it will help students thinking about entering this field in their decision making.
I'm happy to help. I hope it was useful, or that it will be useful to someone moving in this direction. It's a really great job. I love my work. I really do. So I do recommend it. It's not for everybody, but it's great.
Thank you.